All right. Welcome, everybody. We are so glad to have everyone here today for a really great discussion with an amazing group of panelists, I should say. So we're going to get to hear a little bit from all areas of our Federation family and what really everyone is doing to help your mental, physical, and really your basic needs during this time. So without further ado, I definitely want to start us off with Robin Kaplan, who runs our fabulous Olive department. So Robin, please share with us today.
Thank you all for joining us. I'm Robin Kaplan, the Director of Olive Home Care. Olive is a department of the Jewish Federation of Southern New Jersey. Olive has been in existence almost 8 years, and we are licensed through the state of New Jersey as well as accredited. Olive services clients from 1 hour to 24 hours, 7 days a week, and live-in care as well. We provide personal care, which would include bathing, dressing, grooming, as well as companion care, such as meal preparation, grocery shopping, running errands. There are so many different things that Olive will do, and we customize all of our activities, programs, whatever the client wants, according to what the needs are. We try to make sure that everybody receives the highest level of care and are always happy with their caregivers. Therefore, we match our caregivers to our clients. Our clients give us an idea, their families give us an idea as to the personality and the type of a caregiver they want. And we are there to help match them and make sure that we can place an aid with a client so that they can fulfill all of their needs, both as far as personal care as well as social needs. We do provide a free assessment from a registered nurse prior to starting services. We have 2 full-time registered nurses on staff. Our home health aides are certified through the state of New Jersey. And again, home health aides can provide personal care and companion care. They also can transport somebody to their doctors, to an activity, to lunch, to meet a friend. Especially now more than ever during this pandemic, the aides are the connecting force between the client and the family. And so the aide is the personal touch. The aide is the person they're looking forward to seeing all the time. So there's been a whole new light on what a home health aide is able to do, and a lot of FaceTiming is happening between our clients and their families because of the home health aides. We also employ companions, and companions can not provide any personal care, but they are able to, do the laundry and meal preparation and take people out. The key component with home care is to enhance people's lives, no matter how old they are. It doesn't matter. You could be 95, 100, 85. We want to make sure that you're living your life to the best of that you can, and we can help you along the way. We provide care in homes, but also in rehabs, nursing facilities, senior communities, hospitals, pretty much you name it, we'll help anywhere. We also even have gone on vacations with clients. So we just want to make sure that we're there in any capacity. We do have transitional care nursing, and that is a very special program that we started 8 years ago, almost 8 years ago. And that is when one of our registered nurses provide care in a greater level, at a higher level, as far as visiting with a client. They check their vitals. They also can do medication box fills. They're also the liaison between the doctor and the client and the family. And they also can attend doctor's appointments and really can make sure they address the situation prior to it becoming escalated. And it's very important that our nurses can help in a way when the families can't be around. And we definitely give great peace of mind when our nurses are visiting with clients additional days and hours, and especially when they're in touch with the physicians and the family, and if the families cannot be available. And I also want to give a shout out to our registered nurses because it's National Nurse Day, and they deserve the highest level of kudos as far as being out and about and during this pandemic and helping clients, and again, reassuring the families. So thank you to our two nurses, Michelle and Amy. The one key component about Olive and how we're different is what I want to focus on. Olive Home Care is so focused on customer service. That is our top priority. There is nothing that we say we can't do. We just want to make sure we please all of our clients. And there's not one cookie cutter way that we can do that. So everybody has different needs and wants, and families have different needs and wants for their loved one. And we're there to customize all of the care according to the needs and wants of each one of our clients, and to also reassure the families, because home care is not just about personal care and caring for the client, but it's also the reassuring to the families. And I have to say that our clients have really become our family, and they have taught me so much and have educated me on what it's like to be a senior and elderly person, and their stories are beautiful. So for that, I'm grateful and thankful for them just as much as they're thankful to get the care. And during this pandemic, we're here for you. We're here to help. We're here to assist. We're here as a sounding board and available to talk about resources. And if it's not our resources, we're here to hook you up with the resources in the community that you need. So thank you so much for allowing me to speak about my true passion, which is taking care of the elderly population and those in need. And I'm grateful for the opportunity.
Thank you so much, Robin. I know, just from personal experience, and we've talked about this a little bit before, my grandmother isn't at home, and really her only connection right now to the outside world is the people helping. And it's beyond beautiful. I had a conversation really early on with Michelle, one of your fabulous nurses, who is taking the time and connecting people and the clients with their families through FaceTime, and just on a personal level. That's beyond important for both our mental health to see our loved one and for them to see all of us. So just a huge thank you to the work you're doing. And I just want to take a quick moment before we roll over to Brian, that anybody can use the Q&A function, and any one of our panelists will either answer it at the time or we'll go through around at the end, and we'd love to hear from everybody who's joining us. And with that, I would like to introduce Brian from our JCC.
Good afternoon, everybody. My name is Brian Adler. I'm one of the assistant directors at the Katz Jewish Community Center. And first and foremost, I want to thank everyone for joining us today. So since the day that the JCC's doors were shut, we knew that we were going to have to really redefine our business in a completely online platform. And we began that really twofold. We added a lot of enhancements to the JCC website. So I would encourage you to go on to katzjcc.org. And there you can get the big picture of everything that's going on in the course of a week. And if you're on Facebook, which I know everybody is nowadays, and if you're a JCC member, please tap into the Katz JCC Facebook members page. To date, we have almost 1,500 people that are active participants each and every day in the Facebook page. They are logging on for classes, a lot of fitness and wellness classes. They are logging on for book discussions, film discussions, meditation. I have to tell you, I'm one of the people that's on every Friday morning for our early childhood Shabbat. It is great. We're averaging around 75 families that are joining us every Friday morning for Shabbat. And the kids love to wave at one another. The teachers also interact with the kids. It's a really, really wonderful way to end the week with our early childhood Shabbat. If you look to the JCC page, to go back again, the web page, you'll also see approximately 48 different activities that are happening throughout the week. There is something for everybody. There's meditation, there's STEM for kids, where you can do a lot of the STEM, the science, technology, education, and math activities with basic supplies that you have in your home. One of our favorites has been something on Monday. Our membership assistant director, Julie Seifert, has been doing self-care tutorial tips. She's done everything from how to deal with the hair that's changing to face masks, and I think she's got something coming up on nails. I'll also give a personal plug for my own little cooking show that I've been airing on Friday afternoons. And I'll let you in on a little secret. This Friday, it will be my Shabbat chicken. So we're still connected virtually with the community. We would love it for you to hop on and check something out, whether it's something for your mind, body, and soul. The JCC definitely has something for you to experience nowadays. Thanks.
Thank you, Brian. I will say, I think Brian is being a little bit modest when he talks about his little cooking show. I think it's practically viral at this point. Yes, you should definitely, if you can, check out his and all the others. And I just really want to emphasize what Brian just shared. JCC, really, you're focusing on your mind, body, and soul, and the way you quickly pivoted, really, to embrace this new world we're living in. Is truly astounding and amazing, and what you're providing for the community and the members. And once again, we just appreciate you doing that. And if you have any questions for Brian, feel free to put that in the chat as well. All right.
Even the chicken recipe you can put in the chat.
Well, then, oh my gosh, I will be flooded if you do that. Yes. So I'm going to actually hand it over to Lisa with our JFCS right now. Thank you, Lisa.
Thank you. So Brian, I think you found your next calling as the next celebrity chef show when we get our commercial kitchen in your house. So hello, thank you for having me. I am Lisa Rosenberg. I am one of the licensed clinicians at JFCS. And I first just want to say that, you know, each part of the Federation has really come together collaboratively to support everyone's needs in the community. And I want to thank each agency, each part of it, each piece of the puzzle to create the picture that we have in supporting our community. So first, thank you, each of you, in your doing your parts and as a team. I'm honored to be able to work, you know, under such a great organization. JFCS has really worked similar to what Brian was saying, where we, as soon as our physical doors shut, we got everyone together, put our heads together, and within 10 days, we were up and running fully virtually, having programs for food, you know, people that were having food insecurities through our food pantry still. The senior services department was continuing, helping assist get meals to our clients who were unable to pick up meals anymore. And so when we started to brainstorm, we've really been able to develop programs to continue to support all of our clients and branch out more and even more into the community. We are continuing to have our telehealth support groups, our telehealth helpline, which is available to all community members. We, as therapists, we have our clients that have been moved to doing telehealth therapy or teletherapy. Our clinicians are currently serving over 60 to 100, between 60 and 100 clients per week via telehealth, which is fantastic. We have new support groups that are starting and continuing. We actually have a brand new support group starting called for grief and loss right now that has been much needed. That will be starting in the near future. We also have an anxiety workshop and a coping skills workshop that we've done already within 11 synagogues in our community to really help all different community members manage and deal with the new life that we're living. Whether it's parents of young children trying to navigate working from home and keeping everyone out of each other's hair, or teens that are coping with the loss of, you know, so many milestones of their life, or seniors that are, you know, struggling to figure out how to navigate the one or two outings that they might have had each week that kept them going in terms of that physical connection. One of the brand new support groups that I can't forget to mention is that we are starting a Healthcare Heroes support group to really be able to support the people that are out there on the front lines, to help them with their behavioral health, their mental health, and their self-care, because as each of you have said, self-care is really important, and each group has been helping support it. So we are starting a Healthcare Heroes group. We actually just hired 2 brand new clinicians at JFCS over the past few weeks, and one of them is an addiction specialist. So we're helping to increase the support of people in recovery and their families. The senior department, I'm just going to say they've been fantastic in reaching out to hundreds of clients via phone calls and check-ins, because so many of our community is struggling to connect virtually with the technology, and we want to make sure that they are included and supported continuously. So hundreds of phone calls to our senior community. We still are doing our support groups online, the widow, widower, the caregiver support group, Aging with Pride, Cafe Connection. And for our special needs department, we are doing every day, there's virtual activities through TOPS, whether it's physical activities, emotional health activities. The Weinberg Commons groups are doing yoga, meditation, and we're really creating new content literally every day. And so it's really exciting to see how, given this situation that is often out of our control, we're able to really find new and creative opportunities to help continue to support, and possibly new ways to support each and every one of our needs that have to be met in the community. And we are honored and grateful that we can do that.
Thank you, Lisa. So you briefly touched on telehealth, but there was a question that came up to just go a little bit more, and maybe, I know you have your new 30-minute program, so share, maybe really define telehealth for everybody, and then share a little bit more.
Absolutely. So we, when we moved over to virtual counseling, telehealth, we had to find something that would work for everybody. And we found a platform that is HIPAA compliant, it's completely confidential, it's making sure that our clients are able to maintain their services that they were already obtaining in person. The problem we had was that we were getting a flood of calls, and we couldn't figure out how to support the people that weren't already either on our in our client caseload or on our wait list. So we opened up a telehealth hotline, which is open to everyone in the community, and people can pay $36 for 30 minutes. They do not need to be established clients of JFCS counseling already, JFCS services at all. And there is Kim is one of our licensed clinicians. She is the one who currently navigates the helpline, and she will schedule appointments based on her availability, your availability. And so it's a place to be able to say, you know, I'm kind of struggling more than I was before all of this happened, and I just need someone with an objective point of view to kind of listen and talk me through and maybe give me some strategies for dealing with this new way of life right now. And so that's what the helpline is for. It's really there to give some extra support to those of us that are kind of taken back by what's been going on and how to best learn how to live with these changes.
Thank you, Lisa. And as a reminder, anyone is welcome to reach out and ask us some questions. And now I'm going to hand it over to Ronit Boyd from the Federation.
Thank you so much. I actually asked to be last, and now I'm regretting not going first. Thank you all for what you're doing. You are truly making a difference in our community every day. And I think that what helps us all get through this pandemic is knowing that there is so much good going on. So I want to add to something Lisa mentioned and do a little bit of a humble brag for our community that our offices first went remote on March 17th. And on March 20th, we made our first delivery to an older adult in our community who could not get to the store to safely get food for themselves. And the fact that we're able to mobilize so quickly is just an indication of how committed our community is to helping those in need. And we've had, I think, over 80 communities now reach out to us asking us how we're running all of these programs to learn from us. And we don't have all of the answers, but we're certainly doing our best to help as many people as we can. And I actually wanted to focus my time with the community on sharing resources that are available online, because that is the way we are all connecting now. We are all together in this virtual world, and our Federation system has been really hard trying to put as many resources together as we can in one place so that you don't spend hours looking for resources. This might be some one-stop shopping for you. So we do have our community resources website that we are sharing with you right now so you can see them. And there's several pages available with all detailed resources. First, obviously, our resources, just telling you a little bit about our agencies and where their focus is right now for the pandemic, and you'll see some useful links. So I just want to give you a little bit more examples of what you'll find on these links. For those people who are really internet and or Facebook savvy, I think every day I see new resources available in terms of food resources. So what does that mean? We have seen so many people in our community kind of pivoting their businesses, just like the JCC pivoted from being a physical space to a virtual space. Well, a lot of our restaurants now went from serving you wonderful meals inside their buildings to serving them outside to you. Curbside pickup. Caterers now are using their wait staff to deliver meals to you. Farms who maybe once did the farmers markets can now deliver to you. There are so many resources available, and we are doing our best as we learn about them to put all these resources available in one spot for you to see what's available. And we also want to suggest that if you know of any resources that are not included here, please share, because some people are just a little bit more savvy in how to find this information. And we want to make sure that we have this available for as many people as possible. And in addition, some of our resources like the food banks and Meals on Wheels programs are listed here as well. So that is some of our food resources. And again, please, if you know of any, let us know. We want to share them. Now, next, we've developed a site on home life, because that's where we all are right now, in our homes. I'm living here with my 4 children and husband and 3 pets, and it's been about 3 years since we've all been under one roof. So it's been interesting, but just like Julie from the JCC is sharing some tips, we actually did go online to YouTube, and my oldest daughter cut her twin brother's hair after a tutorial. So again, we're just trying to put all these resources in one place for you, some how-tos, some tips about homeschooling, because we now find ourselves being teachers as well as parents at this time. One thing that I love now is all of the museums who have gone virtual. So we've posted some ideas for you on some virtual trips that you can take. I did have friends who were supposed to go to Italy, and unfortunately their trip was canceled, but they did a virtual trip. So maybe it's not second best, but it's third best or something like that. And again, many of our agencies are providing resources as well. So we want to encourage you to look at them, and you'll see there what additional resources are listed. Then local, and the synagogues, the local synagogues have amazingly all pivoted to do online services and resources and study groups. So any of the synagogues who are available online, we're posting that information here as well for you. So just remember, if they're using Zoom, you might have to register in advance. It's not easy to just tune in anymore. You do need to get links. So I do suggest plan a little bit ahead so you can contact any of these programs in advance to make sure you get links, the proper links to register in advance. Then there's local support, and this is really an important page, because obviously in addition to the resources we're offering here at Jewish Federation and our agencies, your local town, your county, there are so many people and resources available to help you. And we encourage you to leverage every resource you possibly can if your family is in need. Even before you're in need, we want to be there for you. So please take a look at these resources. And if you are in need of help, or if you want to help, we are also offering some volunteer opportunities. So you're seeing that on your screen quite often. If you want help, if you can give help. Some of the programs we're running now, as Lisa mentioned, are shopping services for those who cannot leave their home. That is our very fun titled Shop and Drop program. And then we just launched our Federation Friends program. I think really one of the highlights of that is if you are isolated alone and you just want a friendly call, a friendly virtual visitor, it can help you with that. And we just launched, as I mentioned, and we already had one gentleman train 2 older adults from our community on how to use Zoom. Apparently there was one gentleman 90-something-year-old gentleman who missed a family Zoom, and he didn't want to miss the next one, and now he knows how to do it. So stories like that really are endearing. And he also trained somebody on how to use one of the food delivery services so they can get some meals delivered to their home. So all of these wonderful things are happening, and you're welcome and encouraged to be a part of them. And then lastly, that we have a whole page dedicated to resources for special needs. If you have a loved one who has special needs and you're looking for some resources, please look at this site. In addition, it goes well, we as a community have what we call our Jewish Abilities Alliance, and they maintain a pretty robust website of resources in our community. But this is a pivot because this really addresses just what the needs are right now, today, on how to help your loved ones who might have special needs get through this pandemic as happy and healthy as possible. So these are all resources available to anyone in the community. Again, if you want help, please contact us and we will do what we can. If you're able to give help, please contact us, as we do have changing needs daily. And I apologize if any of this data or any of this information is outdated, but as you all know, everything is changing from day to day right now. So we are doing our best to pivot with the information we have and when we have it. And kudos to everyone who has been giving us all this information so that we can make it available to all of you. And that's what I have to share right now.
Thank you so much, Ronit. So I'm going to do a quick panel view so everyone can see all of our fabulous panelists really quick. There you all are. And I'm just going to open it up to everybody. We have about 1 or 2 minutes left. If everyone just wants to share, I think that really in this time that all of your different unique perspectives have given you a little bit of a different message of hope or positivity, or something that sort of came out of this that was really unexpected. And I would love to just share with everyone watching just that little bit of a positive message before we sign off. And I will go ahead and mute everybody. So feel free for anyone to jump in. And go ahead and start. Or
I can start. I'll start. I just want everybody to know that there's nobody that needs to be alone. We are here to help, whether it's our department or another department in the Jewish Federation. We need to support one another, and the key is to stay connected, so nobody should feel alone. We're here for you, and anything we can do to make it a little bit easier, please call us. We'll get you connected to the right department or whomever it might be, but we don't want anyone to feel alone, whether you're elderly or not.
Thank you. Anyone else?
I just want to share an email I got from one of our Parkinsons Connection folks from earlier today. They had a committee meeting that I happened to have been on, and she sent me a letter afterward. And just to paraphrase for a second, she writes that she's truly grateful for all the hard work and creativity that our staff are both investing in the program during the quarantine. And while she said she misses her workouts at the gym and seeing everyone in person, the Zoom classes have really helped her to stay connected to her exercise regimen. And, you know, for what you may or may not know about folks with Parkinson's, the exercise classes we've been offering them obviously don't make the disease go away, but it really helps them to deal with it. And in Melissa's case, she said that she's never felt better having these classes, and the fact that we're still able to offer them online is helping to keep her and her family in a much healthier state. So I felt really good about getting it, and I thanked her greatly for taking the time to write that over to me.
Wow.
I will share that, you know, something that one of my clients said was that even in midst of all the losses that she has been experiencing during this time, she feels exactly what Robin and Brian said. I'm going to echo. She feels that she's not alone. So even though she, in some ways, she voiced that, you know, she feels like she's losing everything, everyone, in her words. These were her words. She said, but I don't feel alone because of all of the outreach, because of all of the different programming and support that the agency has been able to provide. So it's good to know that even though we're physically distancing, we're still truly able to socially engage and connect with the community.
Ronit, final last words?
Listen, sitting often days alone all day in my home office, it's just so comforting to know what a caring and giving community this is. We have over 250 people who have offered to volunteer, and this went from like 0, we didn't have this list a few weeks ago, to more and more coming in every day. When JFCS did their food pantry collection the other day, over 200 cars showed up with loads and loads of food to be given out. So no one is alone mentally, physically, socially. We are certainly here to help. And please call us, email us, we're here.
Thank you all so much for spending the last half hour with us and really sharing not only the amazing work as individuals you're doing, but as your entire team and all the people behind you and working really hard, from lay leaders to volunteers to staff, really just working to make our South Jersey community the best it possibly can be. So with that, thank you all for joining us, and we will see you next time for the next webinar.
Thank you.
Thank you.
Thank you.
Bye, everybody.
Bye.
Stay safe.